Good morning or good afternoon, depending on your time zone. So maybe you were with a patient, maybe it was your brother, your mother, or your sister, and they came in for an ultrasound. Everybody's excited to see the baby, to know the gender, see all the pretty pictures, and then you feel a change in the energy in the room. Maybe the sonographer goes suddenly quiet. Um, Hi, Michelle. Thanks for stopping by. Um, and you know that something's not right. Or maybe you had a prior ultrasound and your doctor had a conversation with you and was sending you to a maternal fetal medicine specialist, such as myself, to have a conversation about what we're about to discuss today, which are birth defects. Um, in either scenario, it is not something that a woman wants to hear about her future child. And so it's sort of hard when that information comes to you to then pause on the emotional anxiety and all of that other stuff to hear the information that you need to hear. So I'm going to try and break it down because birth defects are really quite broad. And if you think about how we put our bodies together, it's tantamount to having a blueprint for a house where the blueprint is our chromosomes and our genes, influenced by environmental factors. And then there may be either a misread in the blueprint that makes you have a plumbing or a room that's quite not right, but what's not right is very dependent on where, in the baby's case, where the organ is. So let's say that birth defects can be distinguished into major and minor defects. What are major defects? Major defects are those systems are affected in such a way that it's going to affect the quality of life. It may affect the lifespan. It may impact the overall health of the baby. Those are major ones. So I'm going to give you a couple of examples. Spina bifida, which is a defect in the spine. The higher up the defect is, the more complications the child is going to have. Down syndrome, trisomy 18, trisomy 13, even something as a cleft lip or palate, which is kind of under a major. But the beautiful thing about a cleft lip and palate is that it's very fixable, it's treatable. But if it's not fixed, then there may be feeding issues, there are going to be dentition issues surrounding that. And now, so I've kind of given you a little bit about the major ones. Now, the minor ones, by and large, have very minimal impact on how the baby is going to thrive or survive. So maybe an extra toe, maybe a skin tag, maybe the ears just kind of look a little funky, maybe because mom or dad has funky looking ears, but the baby can hear and all other systems are fine. An umbilical hernia, that's not, those are considered minor birth defects. So why do they occur? As I talked about earlier in our talk, if the blueprint that's putting together the organ systems and where they're supposed to be and how they're supposed to work, if there is something off in the instruction manual of that blueprint called the chromosomes or the DNA, then you can have a baby that may have these kind of deformations. There are other factors too, such as environmental factors. Now, folic acid was a thing that we figured out um, that we weren't getting enough of, maybe because we're just not eating as much vegetables because we either can't afford it or it's just not in our thing. But we have fortified breads and fortified foods. But a paucity of folic acid can cause spina bifida defects as well. Most of the time we don't know why these things happen, especially if there's no family history. So I'm going to pause for a little bit. I have a question from Michelle asking, are those minor birth defects detected before birth? If they're minor, like the ears, the extra digits, certainly, and that's also dependent on what type of ultrasound you're getting. If you're getting what's called a detailed ultrasound, then we're looking at the digits, and sometimes if the baby cooperate, we can count the digits. So extra digits like polydactyly, if it's on the thumb side or the pinky finger side, we can see that. If we know that there's an ear defect, particularly if it's associated with another major genetic disease, yes, there are tools in our ultrasound tricks that we can look at the ears, but that's a specialized ultrasound. If you're just going for a routine ultrasound at Joe Schmo Imaging Center, it's not likely that they're going to find the minor defects. But if there's a family history or there's something in the obstetrical history that's making your MFM specialist or your obstetrician curious to dig in a little further, then a detailed ultrasound with an MFM specialist would be recommended. I hope that answers your question. Okay, so why do the birth defects occur? They're sporadic. We don't know why most of the times. The chromosomes, which are like the blueprints, because of how we make our sex cells, we as women don't make our sex cells. So all of the eggs that we've had from birth till we go through menopause, that can make the chromosomes sticky, and that can increase our risk of Down syndrome, trisomy 13, trisomy 18. And that's age related, but you're not spared from it if you're 15 and pregnant. But if you're 40 and pregnant, yes, your age-related risk increases, but it's just as, your risk of having a chromosomally normal baby is good as well. So I don't want us to start thinking, oh my God, I am X years old and I'm now, a term that I despise, geriatric in the pregnancy. However, we do know that birth defects can track with chromosomal conditions. Last but not least, you're welcome, Michelle. Last but not least, how do we prevent? Prevention is really aimed at supporting the environment. So if we're not eating so well, and we know we're diabetic, for example, we do know that glucose is teratogenic. Developing cells in a persistently high glucose environment tend to make mistakes and tend to give pretty much any birth defect from head to toe. So if you know you have PCOS, if you know you have a family history of diabetes, and maybe you're just not at your ideal weight, good idea to check out the diabetes status before we get pregnant. Now, life happens. We get pregnant and we're not planning to. That's okay. We're going to say, okay, we peed on that stick. Let's find out if I'm diabetic and let's see what we can do. Starting your folic or your prenatals. Prenatals will have sufficient amount of folic acid. If you're a mom that has had a prior baby with spina bifida, then you're going to need extra folic acid. So it really is wise to try and plan pregnancy so we can get that folic acid in you before conception occurs. Maybe you're on certain medications. If you have rheumatoid arthritis and you have this methotrexate medication that you're taking, that needs to go. If you have seizures and you're on this medication called Depakote, please do not get pregnant. Stop the Depakote and let's transition you to something else. In fact, I would go one step further. If you're able to get pregnant and you're on something called valproic acid or Depakote, please go to your primary care doctor and say, beg you please, doctor, please change this medication for me, because we don't want to have an accident and then we have a problem with medications on board. Good afternoon, Snooky. Thanks for popping in. So that's what I have. It's disappointing if there is an ultrasound that identifies a thing. However, knowledge is power. And so once we kind of breathe after hearing that unfortunate news or unexpected news, because not all news is unfortunate, you can come, we can schedule a telehealth. You can just find somebody who's an expert and get your information and help you figure out a plan. So this is Dr. Heather from my brick and mortar office in Claremont, Florida, wishing you a wonderful morning / afternoon. Just came from California, so I think my body is on morning time. Anyway, the day will end and I will catch up. I want you to walk good. I want you to breathe. You can check us out at Unity MFM. If we can help in any way, don't hesitate to give us a call. If we can't help you, we'll figure out who's close to you that can help you. All right? Walk good. Peace. Have a great day.